Adventist Guam Clinic Chief Executive Officer Ted Lewis says not only is there not enough physicians at SDA, but everywhere else on island.
For instance, the number of orthopedists and cardiologists on the island are pathetically low, and we have no pulmonologists for 160,000 people. To me, this is unacceptable.
And in just the last week, the SDA management team and board approved a plan to possibly help with the situation.
So we've launched on an aggressive campaign to hire 20 additional physicians in the next 2 years.
Lewis says SDA currently has 14 full-time physicians and is developing relationships with medical schools stateside to recruit physicians to come to Guam, some of whom in just the last few weeks signed a contract with SDA.
So the process of getting physicians, it takes time, but we're building the momentum.
But as it works to recruit and bring in more doctors, Lewis says he's been challenged with getting some of his physicians credentialed, particularly with Take Care Insurance.
And the term credential means that they will recognize the physician and will pay their members if they see them for a visit. So if a physician comes in an area where they have what they think is an adequate amount of medical staff in their FHP clinic, the practice has been that they won't credential them with us. So maybe a year or so it wasn't that big a problem, but now there's more and more of our doctors that they don't recognize and pay for.
As a result, the SDA clinic has since given notice to Take Care Insurance that it will be terminating their current contract because it has refused to reimburse the clinic for services of certain physicians. Lewis says he's heard of other clinics experiencing the same problem. Guam Medical Association President Dr. Thomas Shay, meanwhile, says he's unaware of the details regarding SDA's decision or its business plan in expanding, but he says the matter is of grave concern.
The Guam Medical Association, we are very concerned regarding credentialing of physicians and providers, especially insurance companies.
Shay adds with over 220 providers from nurses to doctors in the GMA, he says it's important for all insurance companies to not only credential a provider, but to make payments in time.
For an insurance company to not credential a provider because, for whatsoever reason that they have, I don't think that's too friendly. I mean, the island is small. You want to be able to work together, and you want to be able to ensure that a patient has your choice of doctors.
In addition to this concern, Shay adds GMA has also raised issue with the lateness of payment for claims from insurance companies and is working to improve the Prompt Payment Act of Guam. In the meantime, SDA currently estimates 150,000 encounters a year, in which Take Care accounts for 9% of its total customer base. He says the notice to terminate the Take Care contract allows for a 90-day clause that ensures Take Care customers are still taken care of. And after repeated calls and email messages, Take Care management had told KUAM they have no comment at this time. We should note this isn't the first time Take Care's practices have been scrutinized. Last year, the Guam Memorial Hospital terminated its direct payer agreement with the insurance provider after concerns were raised about its pattern of coverage denial. However, after further negotiations with the hospital, the termination was rescinded. Also last year, while other insurance companies were issuing rebates as part of Obamacare, Take Care subscribers weren't paid a penny. Instead, stockholders were able to split $15 million. This despite 2011 audited financial statements indicating unpaid claims for the year increasing to $11 million and total liabilities increasing to $19.7 million. Reporting for Guam's News Network, I'm Ken Quintanilla.